Hi everyone, my name is Veronica and I recently attempted the ADEX exam that was administered under the CITA agency, and I managed to pass the exam. So I'm here today to share with you my experience. The reason why I'm making this video is because when I was preparing for the exam, there wasn't a whole lot of information of how people felt going into the exam. And so I thought I'd share my personal experience, and hopefully that will give you some reassurance and help you feel more comfortable when you attempt your exam. So I just want to remind y'all that my exam was administered under the CITA agency. CDCA also administers the ADEX exam. I don't know if there's any administration differences between the two agencies, but keep in mind my experience is based on the CITA agency. You should also know that I took the exam in October of 2020. So depending on when you attempt your exam, your experience may be quite different from mine. And this is because, we're all living through a pandemic right now. Security and safety guidelines are changing pretty frequently. So when you attempt the exam, it may not reflect the experience I'm describing today. So just keep that in mind. So today I specifically want to talk about the restorative and perio portions of the mannequin exam. Let's first start with the restorative portion. So right now, the restorative mannequin exam is administered using the compudent teeth. So compudent teeth are not just regular typodont teeth. They're teeth that have distinct layers of enamel and dentin. And they're also pre-populated with simulated caries, right? So the first thing to note is that there's a lot of variability in terms of how much caries is in each candidate's assigned teeth. One candidate may have to prep a larger lesion versus another candidate may have to prep a smaller lesion. So what you want to focus on is your own lesion. Prep to ideal dimensions following the guidelines on the score sheet. Once you've hit those ideal dimensions, take out your Explorer and feel for residual caries using tactile sensation. It's not enough to just visually evaluate if caries is still present. You want to make sure to use your Explorer because the residual caries may look like dentin. It's not necessarily going to be discolored. So make sure you're using your Explorer to check all the walls that they're solid. If there's any residual caries, then you want to make sure you're requesting for the appropriate modifications. In my situation, one of my preparations didn't require any modification requests, but the other preparation required one. There were many other candidates that were requesting for multiple modifications requests. So just go into the exam knowing that you're likely going to have to request a modification. Be prepared to do so, but only do so if you need to. Because if you're requesting for a modification and there's no legitimate reason, you're going to get a deduction of points. The next thing you probably want to know is that the enamel layer of the compudent teeth can be really hard and brittle. When I took the exam, I was using a carbide burr to prep my proximal box, and I was getting really impatient because the enamel layer seemed really hard. And so I kind of used a good amount of apical pressure, and then suddenly, I just dropped into the dentin layer. Thankfully, my burr didn't drop too far apical because that would have, caused me to over prep. But in retrospect, I wish I were more patient and just, slowly prep through the enamel layer until I hit the dentin layer. So keep that in mind. Another thing I experienced is enamel chipping outside of my preparation. And this was caused by using probably too much force on a hand instrument. So if you're going to use hand instruments to either excavate or kind of refine your line angles, I would suggest always using controlled forces because you don't want to have any enamel chipping on your preparation. I've heard that Occidental has been continually modifying their Compudent teeth, and so supposedly there's like a second generation of teeth now that won't have this issue of enamel chipping. I'm not sure when they're rolling it out, so when you take the exam, you may or may not have some issues with enamel chipping. I believe that Occidental has released the RTX Carry Teeth. These teeth are, from my understanding, not exactly the same as the Compudent teeth, but they are teeth with simulated caries. I personally haven't had any experience with them. I don't think they were available when I was preparing for the exam, so I never practiced with them. I just practiced on regular typodont teeth. But if I were taking the exam in the near future, I probably would purchase some of these teeth just to, get a feel for how simulated caries is going to feel like. So if you're preparing for the exam, it might be worthwhile to invest in a few of these RTX Carry teeth that are available on the Occidental website. So now let's talk about the perio exam. So the typodonts for the perio exam are not as sophisticated as the restorative portion of this exam. I'm pretty sure ADEX has said that they were going to continually work on the perio typodont, so they're probably going to have improvements in the near future. When I took the exam, we were only graded solely based on our ability to scale and root plane the assigned teeth and their surfaces. So there was no exam measuring our accuracy in terms of probing, only on our ability to remove calculus. The periotypodont teeth are relatively soft, so it was pretty common for the surfaces to be scraped off by our scalers. So keep that in mind. When you take your exam, if you see some white stuff coming off, don't panic or don't get too worried about that. Our floor examiners also recommended that we put finger pressure on the teeth we were going to scale because sometimes the teeth would pop out of the sulcus. Now, if that happened, we were just told to put the teeth back into the sulcus and continue to scale. If that happens to you, again, don't worry. The examiners are probably aware that this is an ongoing issue. So you might be interested to know that the calculus is very dark in color. And so you can kind of see through it in the sulcus when you move your probe around. So that may help you in determining, if you've left any calculus anywhere. One thing to note is that if your testing agency has said that, you're going to be allowed to use a Cavitron for the perio portion, I'd recommend that you be prepared to hand scale if necessary. Because what happened at my exam is that we were previously told Cavitrons were allowed, but on the day of the exam, the examiners told us that only hand scaling would be allowed. So just be prepared to hand scale because you may not be able to use the Cavitron. I hope this video was helpful to you, and hopefully it gave you a little bit of reassurance that, this exam is definitely doable, especially for someone like me. I'm a periodontist and I haven't practiced general dentistry in over 4 years. So if I can do it, you can certainly do it too. If you guys are interested in knowing about the prosth portion and the endo portion, or how I prepared myself to take the ADEX exam, given my background, I'm more than happy to share that information with you. So best of luck with your upcoming exams. I hope you guys do really well. If you know anyone who may benefit from this video, your classmates, any other future candidates, feel free to share this video with them. Thanks for watching.